Just hold that thought for political pages. Let's take our viewers to State House, Nairobi, where the spokesman, Manoah Esipisu, is issuing a statement. Let's take you live there and find out what he's saying.
Full car-free days for Westlands and the Central Business District. A traffic management committee, the bus rapid transport system should also be in place, as well as the automation of bus termini and improvement of non-motorized travel. The launch of the BRT will be preceded by the availability of 39 buses and infrastructure improvement on Langata, Mombasa, Jogoo, and Juja roads, as well as Waiyaki Way. Third, health is a big issue, and especially the lack of accident and emergency facilities in most of the city. This will take longer than a month to fix, but still significant progress is promised within 6 months. That progress will include the improvement of facilities available at Mbagathi and Mama Lucy hospitals in terms of their trauma care, as well as in order that they lessen the pressure on Kenyatta National Hospital so that it can do the work for which it is set up, which is referral care. The upgrade of Matwini Hospital to level 4 status and the upgrade of 10 other high-volume health centers has already been identified, and we should see progress in that as well within 3 months. Two other matters. One is housing. Already you've had discussions around the setup of the Kenya Mortgage Refinance Company to help with bonds for affordable housing. But what you will see that will tell you that affordable housing is taking root in Nairobi is a breaking of ground on Park Road for 2,000 units of affordable housing, which should happen within the next 3 months, as well as 5,000 houses in Shauri Moyo, 20,000 houses in Makongeni, and 3,000 houses in Starehe. The team for those last three has a 6-month deadline to ensure that the breaking of ground happens and that construction work begins in earnest. The second matter I would like to reference is the President's universal health coverage agenda. Ensuring that each and every Kenyan has access to affordable health care is one of the President's big four ticket items in his second and last term as President. The President is taking aggressive steps in ensuring that that plan works. Already the counties of Kisumu, Machakos, Isiolo, and Nyeri have been identified for a 100% pilot on universal health coverage. The pilot is important because it allows the government, the national government, and the county governments to assess the efficiency and effectiveness of facilities and institutions that are key to delivery. It allows to assess the availability of human resources, logistics matters, and more importantly, how citizens are engaging with the program and how citizens are reacting to the program. At the heart of the program are citizens, Kenyan citizens. So this is not about just who is running the program or under whose mandate it's supposed to be. This is about ensuring that the Kenyan citizen gets the service for which the Kenyan citizen expects his or her government to be engaged in. The other 43 counties will also run pilots, but they are limiting this to 10,000 citizens per county. This is, of course, on a much smaller scale compared to those ones doing 100% stress tests, but it allows counties to also start to see how universal health coverage will work in their own areas. And it also allows counties to assess the facilities they have and how these facilities will respond in a situation where UHC has taken root. Secondly, for universal healthcare to actually work effectively, we have to look at how to go around preventive measures so that common diseases are reduced or curbed so that they do not become the source of stress as they are now on the health facilities available. That is one of the reasons why Health Cabinet Secretary Cicely Kariuki is going to Cuba in this week. She is going to close on key agreements critical to the President's agenda to reduce common illnesses such as malaria. In collaboration with Cuba, the government expects to launch this year a malaria vector control project in the counties of Busia, Kakamega, Bungoma, Siaya, Kisumu, Migori, Homa Bay, Kisii, and Nyamira, which, as you know, some of those that are worst affected by malaria in our country, and where it requires aggressive implementation to ensure that there's a significant reduction in malaria, or there is, in fact, an end to malaria. Why are we working on Cuba on this? Some people have asked. The reason is really a simple one. Cuba has managed to eradicate malaria. Their methods, their medicines, their technology is proven, and we are collaborating with them to ensure that we can transfer those methods, that technology, those medicines to our environment. Technology and medicines are to treat diabetes, foot ulcers, and vaccines for HIV-positive people to reduce CD4 count, and also significantly reduce the ability to transmit HIV, is also part of the discussions that Cabinet Secretary Kariuki will be.
State House spokesperson Manoah Esipisu, they are issuing a State House briefing on various issues, talking about the bus rapid transit system,